Good evening, viewers. Hope all of you are truly doing safe and well as well, as we have completely unlocked. And as you all know, we are running the bone, muscle, and joint series with Dr. Aashish Arbat straight from Pune. And we are very happy to be back on this week's program with him. Uh, just before we start the program, I would like to give you our introduction of our platform. True Wealth, as you know, is an integrative healthcare initiative guiding patients and healthy individuals to overcome their health concerns and manage self health to reach the ultimate goal of holistic health and happiness. True Wealth live programs platform actually aims to help you separate science from hype by sharing authentic knowledge and wisdom from healthcare and nutrition stalwarts so you can make the right health and nutrition choices. TRUWELLTH's ultimate goal is to provide integrative and personalized health and nutrition advice to achieve health and happiness. Also note that this live program, which is telecasted now on 6 different channels, is organized to get more information and guidance to keep health, nutrition, and fitness. And the recommendations, experiences, knowledge that is being shared on this platform is completely for an educational purpose and not for any sort of personalized consultation. However, for we would be glad actually to help you reach our speakers and participants here for a personalized consultation on 98200 48369. That is the number you can reach us, or you could also look at our website www.truewealth.in. If you would like to ask any questions or express any of your concerns during this live program, you can of course do that in the comment box where you are watching the live program, and I'm sure we will try to do more than justice. You can also text your questions and concerns to us on 98200 48369. However, just note that this program does not intend to give any particular advice on COVID-19 and related treatment, as that for that you should be approaching the assigned hospitals and doctors. Having said that, I would want to give you a short preload and brief about this initiative Bone Muscles Joint series, which we are running with Dr. Aashish Arbat. The idea here is to educate people about bone muscle joint health issues in detail, to understand different bone muscle conditions and the related surgeries, treatment regimens, integrative approach for improved outcomes and faster recoveries. That's why we are running this series, and we would like you to understand the benefits and shortcomings of different techniques, the newer techniques that are coming up in joint replacement, shoulder surgeries, trauma, arthritis, and many more topics. What parameters really you should be considering while selecting the right techniques, the right surgeon and his team, very, very important, the right implants, and of course, the role of nutrition in achieving better outcomes. That's really the objective that we are coming forward to you with, and I would like to introduce our esteemed speaker, Dr. Aashish Arbat. He's actually one of the first 3D robotic joint replacement surgeons in Western India. He's a consultant orthopedic surgeon at the Jehangir Hospital and the Sahyadri Hospital, which are one of the very leading hospitals in Pune. He also does travel and globetrot and does operate patients and see patients at the Curie Hospital in Thane, Mumbai, the Aditi Hospital, Ruby Clinic, which are again in Mulund and Kalyan. He, of course, has an MBBS degree, but an MS in orthopedics from the coveted KEM Hospital in Mumbai. He also has an MCH ortho from the Royal College of Surgeons, UK. He's faculty for UKMCH Orthos. He has a fellowship from the Princeton University in New Jersey, US, under Dr. Jeff Abrams, and he's the first Indian fellow under Dr. Ed Sugaya in shoulder and elbow arthroscopy. These are two very big international names. So Dr. Ashish Arbat really has gained skill, knowledge, and experience from across multiple continents, which includes UK, US, and you can see Japan. So he's also he also has a Funabashi Sports Medicine Fellowship from Tokyo, Japan, and has been associated with the IPL Gujarat team, the Pro Kabaddi League India, and Pune Wrestling Federation. He's also involved in devising patient information system for the government of Scotland. Dr. Ashish Arbat is a speaker at multiple national and international conferences. He does a lot of work, camps, and also programs for patient awareness. And we are very glad that Dr. Ashish, we are able to present Dr. Ashish Arbat to you out here on our platform with an extensive series, which he takes his time out every week preparing for them, and so that we are able to get the authentic information up to you very easily at your fingertips. Dr. Ashish Arbat, welcome to our program. We are so happy to have you every week, and like I said, I think we are fortunate, and also our viewers are fortunate to have you share your experiences, not only from all over India that you've been operating patients, but also your multi-faceted experience from all across the world. And today we are coming up with a different topic from altogether that we've addressed until now, and that is trauma, which actually is quite complicated, needs immediate attention, and also needs a right surgeon and his team to be present out there to address the patients. Having said that, Dr. Arbat, how do you feel being here on the show today?
Thanks, Rajashree. It's always been a pleasure to be on your show and the world watching us. And as you rightly said, that we have started this initiative for public education and making people aware of what is going on in these difficult times. And one of the things that has taken a toll in this viral times is reaching the right doctor, especially in the time of a fall and trauma, because life goes on, Rajashri. We are seeing increase in the domestic trauma as well, and especially uh, somehow because people have to drive themselves, they are not used to things. We are seeing a lot of road traffic accidents also,
Yeah,
uh, and they are carrying things with them. They have a fall, and they don't get help because many people are not there on the road. So we will discuss in this series of trauma is to understand what to do in these kind of situations and how can you reach us. म्हणजे आमच्याकडे पोहोचणार कसं हे फार इम्पॉर्टंट आहे. And that I think today we'll make it clear and what all cases that we can do and what are a lot of people are waiting with badly operated trauma or unoperated trauma, and they can reach us watching these programs.
sure. So, totally true, because now everything is really opened up, and yet, getting to the right center and trying to be safe from the COVID infections is a biggest concern. You did have mention to us that you have an extensive team, and at the same time you're still taking all precautions. You have moved to new facilities, which you've always been associated with, especially the Jehangir Hospital and the Sahyadri Hospital, which are taking utmost care so that the patients coming there can be secure, and your team has been taking additional efforts for the same. So viewers, take a note that uh, more than the regular care, Dr. Arbat's team is actually, of course, taking additional care regarding any operating procedures, and even while through right from enrolling you to actually help you get out with a quicker recovery, so you spend very less time in the hospitals. Having said that, Dr. Arbert, of course, we are going to talk about trauma, and like everybody says, and you especially emphasize, is that trauma is really that golden hours. When you meet the accident, or even small or big, the point is, you have to reach the hospital immediately. And what first comes to everyone's mind is probably to reach to the closest hospital, or at times, we are always thinking about which is the largest, the best, and we try to reach out to that hospital. What's your recommendation when it comes to really getting to a hospital, and what are the first precautions that need to be taken when you meet an accident, or in cases of trauma?
Yeah, Rajashree, let us take it systematically and a very well put question. Uh, After a trauma, when you fall down, till you reach the right hospital and the right person, what is important? Let's see, I'll just share the screen with you. See, is the screen seen, Rajashree? Well,
Yes, we can see this
so
screen.
first of all, any trauma place where you want to take for the public, normally काय होतं, पेशंटला उचलतात आणि रिजनल जागी नेतात. फर्स्ट एड इज फाईन. But if it is seen that it is a complex trauma or something, they should, or the patient should know that the trauma should always have a center which has good ICU backup. Like that, like we have here in most of both the centers that I operate. Then they should have an emergency room with available team. So we always work in a team which is 24 by 7 available for doing the right thing because they are trained with us over these 9-10 years. Once the patient is stabilized in the emergency room, we can talk about a lot of things. There are small things that we miss. Say some X-ray, some other trauma with the patient is unconscious. He has to be approached by the specialist himself. What happens is many a times they are taken to either the government centers, and in these times of COVID, most of the centers are COVID positive. So first of all, the center should be COVID negative. So couple of our centers that we work under the big banners are totally COVID free. If you go to some of these centers, you can easily call us and transfer the patient to this COVID negative facility, which has an ICU backup. Second thing, they should have facilities in house like the CT scan and the X-rays and the MRIs. So both our centers where we work has this facility in house. So there is something called as, and then you need to have a good surgeon basically, and he has to be available himself. Many a times what happens, some junior doctor or some person attempts something there in the emergency room, and if the primary surgeon or the person, you know, is not trained under him, a lot of mishaps happen, and we are seeing a lot of this happening in the periphery that they are not being attended at the right time, and that is called a golden hour management of trauma. In any kind of situation, the golden hour in the kinds of heart, brain injury, or a ligament injury or a fracture, the golden hour is something. See, you can see this here, Rajashree. So this is a time that accident happened, and this golden hour is 1 hour, the first hour of trauma. So प्रेक्षकांनी लक्षात घेतलं पाहिजे की पहिला जो तास आहे त्याच्यामध्ये ट्रॉमा और एनी फॉल ह्याला लाईटली नाही घ्यायला पाहिजे. आणि हिअर first is you get a report. You have to have at the arrival. If it's fallen on the roadside, please, anybody watching this program, take him or her to a secure site. रोड साईडला बाजूला घेणं गरजेचं आहे. ती गाडी आणि फोटो काढत बसण्यापेक्षा. Set an alarm, call 108, call the ambulances, and somebody has to arrive there. If nobody arrives, at least there are emergency numbers on the phone. Every person has a phone. If he is conscious, he has to call at least 108 and 100. They should learn from the America that first calling 911 is very important before you lose consciousness or something else and in that pain. And if anybody around you, तुमच्या बाजूला कोणी असेल काय तर सेक्युअर साईटला पहिले घेऊन जायला सांगा. त्या सीन पासून दूर घेऊन जायला सांगा. समटाइम द बाईक फॉल्स, इट कॅन burn, if the car, and take the person out of that situation. The initial access should be within 25 minutes, Rajeshri, ideally. This is something from the ATLS that we was trained in the UK. Initial treatment is the within half an hour the patient should reach a place, and in within 30 minutes if he gets initial treatment like first aid, stopping the bleeding, or every time the trauma is not that bones come out, or but it's an internal thing. He has to be stabilized, and then our treatment starts. So once you reach us, we start the treatment. If primary treatment is done in a small nursing home, आता दुसरं काय होतंय, small nursing homes ला all the facilities नसतात. So take the first aid, get a plaster or something done. Then you can reach out us to all these numbers, 24-hour numbers, and then you can transport. We can also arrange for a COVID-free ambulance. We have arranged ambulances for 200, 120 kilometers from Pune also. Then you reach the hospital, and this is the time where our team can really see you. And this is the golden hour, Rajashree, that I was talking about. And here, there are two, three things to take home. Either इथे दोन गोष्टी होतात. Either you reach a very small center, or you reach a very big center where you really don't know whom to access. So watching these kind of programs, if you reach a very very big center like Sahyadri, you should call in that I want this doctor. And people like me, some people, since there are people who work solo, we work in a team. We have a big team. Our first aid attendants, our first line of staff reaches the patient within seconds and minutes. Then our trained students and the the junior doctors attendants access it. We are in avid use of all the technologies. So we get the reports on our phones, wherever we are, on our mobiles, on our emails immediately. And the initial stabilization starts. Then we can immediately advise some CT scans, some X-rays, some basic requirements like pulse, BP. If the patient is needed to be shifted to a care ICU, so you should have an high density unit and an ICU. Every time ICU doesn't mean you are serious. There is an observation ICU called the HDU. There's a surgical place where the patient is just observed whether he's losing his BP, whether he's, once that is stabilized, then we ourselves, the consultant should see the patient himself. The problem happening with trauma is most of our consultants are, busy or doing OPDs or doing some specialized work like joint replacements and that kind of stuff. So once the consultant sees at least the reports, so what we do is the team is very important. The surgeon whom you are seeing should really have a very, very good team. So in my team, there are around 8 people who are in 24-hour access on the phone, physically. There are people whom we have placed for logistical management. And in these COVID times, there are money issues, other issues. Second thing, the centers that we work are totally COVID free. So that is one thing that I will advise, that reach out to the right person is also, I think, to be included in the golden hour. In the first hour or the second hour, our team also informs the relatives. They do the MLCs themselves. So patient is very comfortable, and they take care of the logistics before even the relatives arrive. So that is one thing what we do, Rajeshri, so that uh, we can help the patient in every way. We are getting patients and calls of a trauma from Raigad, from out of Pune, from Pune, domestic fall. What happens is they should learn that if they go to a particular center, they should ask for that particular consultant, is what your question was. They should know. So watching these
Okay.
kind of programs, and today what we are educating, we told you understanding trauma. अंडरस्टँडिंग ट्रॉमामध्ये सर्वात इम्पॉर्टंट आहे की सरळ सरळ घरी नका. लागलंय मग मी घरी I fall down say in Deccan and I stay in Hinjewadi. Before that, you reach a right center. Don't be ashamed that you have fallen down. Ask somebody, please take me to an hospital. Contact us. We will inform. If you don't get the right consultant, you should always have access. There are a lot of internet access. Put our name on the uh, Google, search it, ask somebody to help you in that. Because nowadays technology has, I think trauma is been very overlooked, underlooked also, and people are not able to reach the right doctor. And in the trauma, I again and again tell that first treatment, first surgery has to be the best surgery, because we are coming with a series of revision cases and a lot of other stuff in our coming series, where we are seeing that many other multiple surgeries are done because the first time treatment was not given the right way. And that is happening because trauma has been handled at the periphery. And I feel joint replacements and scopies and spine stuff all are very glamorized fields. What happens is the senior surgeons are not doing trauma, but I think we basically are trauma surgeons. Orthopedics is our mother, and so dharmayam, so trauma. If you can give full justice to trauma, only then you are a good surgeon. And we have always respected trauma. We have always been in searches of technologies like digital X-rays, scanograms, robotics, lot of stuff. We are working all for trauma. Everything should not be focused to joint replacements and other stuff where the technology is driving you away from the trauma. So I request that the person should ask for the right consultant, and if the consultant himself is not seeing, the patient should opt for uh, a right person and ask the right thing on Google, because Google is one of the best things when you are flustered. So we are there on the net. You can find it out, and then we can take ahead from there. Rajashree.
Absolutely. Here I would actually, when you were talking about you being orthopedic surgeon at your spine, I would like to, in fact, mention one of the statements, I'm so glad that you're saying that because, I often am a big fan of Dr. N.S. Lard, who is one of the very leading names, or one of the kings of trauma in Mumbai and all over India. And he had one of our programs said that, what are we? We are really an orthopedic surgeon. And yes, and a trauma surgeon saying that. And when a surgeon says that, that itself, I don't want to give you any points or list you as one of the top doctors, but that itself says it all. That your first focus really is to be a good orthopedic surgeon, and that's what you are at the core. And trauma sort of is addressed very well by doctors who have that thought process. Having said that, you did mention that it is very important. We've understood that people should look for the right doctors. In fact, for that. On a regular basis, also patients like us or even healthy individuals should actually be just as we always have a good physician whom we do meet, so that for our regular checkups, we should also be associated with a good orthopedic surgeon, so that most of the times we know that we can reach out to him and find out where and go where he is attached, or at least take his advice wherever we are in terms of finding the right doctor, which is very critical, as you mentioned. You also did mention that it is also important that revisions should not be needed, and surgeries should be done well at the beginning. And we do understand, because in critical conditions and in trauma cases, we don't know what sort of impact and injury that there can be. It could be small, big, it could be intense, deep. Depending on that, it is extremely important. So in that case, Dr. Arbat, could you explain what really can a complex trauma be like? Because if you could give us a few real life examples that you've treated, and that could actually help us understand it better.
Yeah, and to understand today's topic that we have kept is understanding trauma and then complex trauma. So now,
Yes.
taking a real life situation is example: a person falls down with or without a relative, and he's been taken to a center. Fine. first hour, you, like I told you, the golden hour, don't lie there, don't go home. Take the first aid somewhere. Luckily, except the head injury, most of the orthopedic trauma doesn't need anything like an immediate thing like a heart or abdominal stab injury or a bullet injury. We can give some time, say 48 hours or 72 hours before we touch the patient, or there is a swelling to go, or there are very few times that orthopedics goes and operates at site or in that first 4 hours. It's not the heart. So you have some time. That is a liquid blanket that nature has provided. That if you have a bone injury, stabilize it at somewhere. Stabilize it. Go to a local place where somebody sees you. You can, and just see the facility. You have that time. The relatives, call the relatives. They should see the facility, whether this, the center is technically good, and the surgeon. And luckily, what has happened now because of Google, you can see whether the surgeon is trained in the proper center. For example, we come from the background of KEM Mumbai, where we have handled trauma in the one of the highest in India. Highest in India. We have seen bomb blasts, we have seen train accidents, we have seen patients coming from Nepal, Pakistan, Iran, and no what, where trauma has been really taking toll. So you have those kind of trained surgeons around, and please Google it. Just because some doctor tells that I can do this, I always stress that the first surgery, if advised and is done, if it is done well, that is where you can prevent. That is the whole understanding of this topic today, that we have kept a topic today, is understanding trauma. You can take your time. Immediately somebody makes you afraid that atta cha atta karayal lagel वगैरह वगैरह, assess it. Unless it is a brain injury, the patient is unconscious, you really have time in trauma. You really have time in ligament injury. You really have time in fractures. The first pain elevation you do, and then you can contact, you can ask us to transfer that patient from that particular center to the centers that we operate. So that is one thing, Rajashree. I would advise all the people who are listening, and tomorrow they'll listen and this you will post it again, that we are available. It is not important that I reach at the fracture site, go on the road. But once you are stabilized in a small nursing home or a government center, once you are okay and you find the doctor advises now the patient abhi stable hai, you can always have your options of shifting the patient to the right surgeon, because the surgery to be done, if at all, has to be done the first time every time. It's like they write in the US for the drugs, say no first time every time. The first surgery has to be the really, really good one. And here again, Rajashri, at the end of the day, we will talk about robotics and technologies that we are getting for the trauma. Why? Because we don't want the patient to come down with a bad joint or a malunited fracture or a bad implant, which are all we are seeing because they have been taken hasty decisions, and periphery, because of lack of knowledge and the lack of right. So it is your human right to reach to a right doctor. And there is nothing against anybody. I am just quoting it in general. For me also, even if I am there, I have to have the right to choose my doctor. And luckily, Google has given us the privilege in this era, in this generation of ours, that you can take your time. If you know, fine. If you don't know, you can really reach out to us. And that is very, very important in terms of what I was telling you. And then we can discuss some cases where uh, they have really been missed by the local surgeons, and then we have really done difference in their lives. And we will keep on talking. And then later on in coming year times, we are going to talk about how we revised the trauma and how robotics is going to change the face of trauma in the coming future.
I
So
was about to ask you the question on trauma on robotics, basically, because you you are extensively utilizing robotic techniques in joint replacement and are going beyond just the regular robotics, but also trying to integrate more understanding human involvement and integration into it, and the newer techniques that you are always extensively and very ahead of time working on. So I was about to ask you that, are you going to be bringing in
Yes,
robotics in trauma as well? Because
yeah, Rajashree, and coming to this thing, see, robotics and if the doctor is a technology-oriented doctor, why we are using technology is if we have technology is for betterment of life. Uh, जे न देखे रवी ते देखे कवी. आपल्याला टेक्नॉलॉजी कवी बनवतं. We see what we cannot because
yeah,
our eyes. So many people are against technologies and this kind of stuff because they are not trained in it or they have a bias of it. There's a huge bias. It has become a religion that a doctor uses technology and doctor doesn't use it. I would always feel that technology is the future of the 21st uh, generation, the millennial people. This is a millennial world, and technology. Like I'll show you one case where I'll just share the screen.
hmm,
You can see
hmm,
now
yeah,
this X-ray. If everybody sees, most my students are seeing or anybody is seeing, it looks so normal. But this patient comes with stiff elbow, fall in the home, IT engineer, uh, keeping anonymity. We He was sent home, but then I got a call from my one of my old patients that XYZ's elbow is not moving, doctor. You just see the X-ray, and if you can see, can you see this X-ray, Rajshri? It looks so normal, but see this patch here. Can you see my arrow? This is an elbow X-ray, and it's difficult for people to access.
yeah,
There's a small crack in the radius,
hmm,
and there is a capitular chip fracture, which is totally missed.
oh, okay,
Send home with
yes,
a send home with a brace. Normal है painkiller khaza. Imagine this person after 3 weeks of this injury could have got a dominant hand stiffness for life because the joint would be fired. So when he reached, I immediately see technology. The X-ray was sent from Mumbai to Pune. Within 3 seconds, I said, "This is a capitular fracture. Send it to a COVID-free center. I'll be there." Immediately, we did a CT scan and look at the huge, complete humeral chip. Now, this is what the robotics or the technology is helping. What I can't see in the X-ray, what I can't see, there is really no injury on the hand. Nothing. It's just a swelling and complete chip fracture. So we transferred the patient to our higher center in Pune. And what happens is in this kind of complex this thing, the regular surgeons won't be able to do. But since we are doing arthroscopies, endoscopic surgeries, because this area there are a lot of nerves, arteries, and the approach to the elbow without damaging the uh, soft tissues, you require extensive training in India and abroad to handle these kinds because these are only sports injuries. Is most of the I saw these injuries in basketball players in the US, and that's where most of the local surgeons even actually was sent home by two surgeons, and which is a shocker for me. And just because the person is MS or been trained, there are a lot of things they are not being trained in local in private nursing homes or private hospitals in India. And then look what we did. It was completely endoscopic procedure, and these two screws. Can you imagine this kind of surgery? And then the patient. This is a 20 to 25 minutes procedure, but see the joint line, and these screws are
huh,
degradable screws which are being put endoscopically
hmm,
without
oh,
damaging any nerve, without in a very small 3 centimeter, 4 centimeter incision, without damaging the approach. The surgeon has to know the approach. The surgeon has to be done these kind of surgeries. Big fractures, I understand, But these minuscule things in the small joints in the hands, in the elbow, in the shoulder are totally missed. And we had our sessions on arthroscopy where the muscles are we are treating with endoscopy, lasers, and robotics. We are treating the ligaments, which also we had an extensive session on the ACL. So these are all trauma where X-rays will not show you anything. So technology like the MRI, 3D CT scan, robotics, arthroscopy, the arthroscopy is the endoscopy of the spine, those kind of stuff. And within within an hour, the patient who was not able to do anything starts moving and is showing us thumbs up.
Super.
I have his home video which he sent me yesterday. If I can share it, and this is after. Can you see that?
Yeah, absolutely.
And complete movements within 4 weeks. Otherwise, this elbow could have got totally stiff, and he could have lost of his job. And so initially, Rajesh, initial treatment is very important. So there was no emergency in it. The first surgeon sent him home. Second surgeon told him, come after 4 days. I'll see. They might call somebody like me to see it, but they don't have a CT scan. They don't have a robo at their place. They don't have a endoscopy training to do all these small procedures endoscopically. And there are multiple 3 4 cases that I'll be showing that how these traumas are missed and what are the latest technologies. Like example, uh,
Hmm.
this patient, 92-year-old or 82-year-old, not able to move the hip for 4 5 days, fall. I get this X-ray on the MRI on the screen, and somebody says me the 3 days patient is not walking, and the local doctor said X-ray is normal. But see the small chip fracture which is here, totally missed. So we're talking about these missed cases. And now the new technology that has come is this requires fixation, otherwise the patient doesn't walk. So now we do something called a percutaneous nailing and procedures where there are only 2 to 3 stitches. Now this procedure is done under continuous video guidance known as the CARM. We continuously see, it's like a video X-ray. It is totally computerized, and we fix the fracture within a matter of 40 minutes. And day two, within 72 hours, the patient goes home walking without any issues. And day one, the patient starts walking. And within couple of days, this guy or her would be doing all the household activities. But this kind of traumas are missed locally. This kind of traumas people don't treat locally. And even they treat, they don't have the facilities, or because trauma or any orthopedic surgery, ophthalmic surgery, we need those technologies. No? We need those robots. We need those special CT scans, and they are not very costly, Raj. They're not costly. And luckily, if we have centers where we have medical claim facilities. We have centers where we do charity work, like Joshi Hospital. I come to hospital in Mumra, where it is totally done in the government setup. But you need to have the right person in the right setup with the right training. You should always
Yeah.
choose a doctor who's been trained very well for all this stuff. And then we'll be coming to complex trauma. That how complex trauma, if handled well, you can get
Yeah.
excellent results. So, complex trauma, multiple fractures. The patient falls down, say somewhere near Satara, taken to the primary center. Yeah, you can give him stabilization. Immediately, don't rush. Again, I'm telling the first hour, don't rush to a bigger center, to a bigger doctor. That first hour, stabilize the patient. Golden hour. गोल्डन आवरमध्ये फालतूची घाई करायची नाही आणि दिरंगाई पण करायची नाही. नाहीतर ते व्हिडिओ व्हॉट्सॲप कसा पडला बघा आणि मग बघा मी कसा ऍक्सिडेंट बघितला. आय थिंक दॅट इज वन घासली थिंग दॅट आय एम सीइंग नाउ डेज, that people are more interested in showing the video of the fall than to help. Use your phone to search the right doctor, my friends. Be kind to the person who has fallen. It can be you tomorrow, my friends. It can be me
Absolutely.
tomorrow. It can be our child tomorrow. It can be my brother, sister tomorrow. So the patient stabilized overnight. We got a call midnight that such and such is going to happen. I said, wait, overnight, don't rush. It is 100, 150 kilometers. It is in Kokand. We are getting a lot of patients from Kokand that way. And next morning, we arrange for an ambulance. The patient comes, and this kind of see the see the
Mm-hmm.
trauma, the complete left side, all the bones
Yeah.
fractured. And in midnight, as soon as the patient stabilized, we did something called percutaneous plating. Now, if you can see these stitches, Rajashree, one, two, three, four, one, two,
Right.
three, four. There is not a one, two, and this. This is completely done by newer techniques. Why? We have video X-rays, we have CT scans, we have excellent armamentarium. Second question comes, Rajashree, is of the bad implants in the periphery,
Yeah.
in the tier 2, tier 3 cities. Sadly, we don't get the right implant. In the bigger centers and with our team, we are continuously having access to all the good companies which make these anatomical implants and which we don't compromise on at all. Now, you can't even see where the fracture is.
Correct.
Why won't this patient be good after the first surgery, which is done with a minimally invasive? This is called MIS, minimally invasive surgeries. Why minimally invasive? In trauma, we have to save the muscle, we have to save the ligaments. खोलून प्लेट कोणी पण लावू शकतो. न खोलता कमी टाक्यात टाकणं is
Yeah.
what is our specialty. And believe me, uh, this is something known as the MIPPO. Now, these four fractures here, we have passed a 2 mm nail, Rajesh. It is just 2 millimeters in diameter.
Yeah.
I will remove this nail within 9 months. The patient has no scar on the skin.
Yeah.
This plate has two scars. Initially, we used to open from here to here, see the bone, take out all the muscles, and put this plate. And that's the reason orthopedic surgeries used to be morbid. Morbid म्हणजे एकदा हिंदी पिक्चर मध्ये दाखवतात ना की एकदा तिची ऑर्थोपेडिक सर्जरी झाली की त्याला सगळे प्लास्टर लावून तो जॉनी लिव्हर झोपलाय 4 महिने.
Yeah.
South Indian sidekick is sleeping with all the patties around. That is no longer remaining with the orthopedics. If you reach the right
Yeah.
doctor,
Yeah.
you reach the right technology oriented doctor, and that's where Rajesh I was been talking about is you have to reach the right study doctor. Please Google, please see the doctor's qualifications, please see it is your right. India doesn't know that. Now you see in US, uh, if you are staying in New York and you know yourself and you fall in Philadelphia, I've been working in US for so long, you don't get operated immediately in Philadelphia. They
Right.
stabilize you, they call your center in New York, which is your doctor, your company doctor, your peers know that. And he's then shifted to New York by air, by car, by road on the next day or something, and there they operate. And I think with our generation, I am making efforts to tell even the government that experimental surgeries on patients should be stopped. You should have the right certificate from the right centers to touch human beings because we have to have respect of our work. I'm seeing a lot of, I'll just be sharing in couple of days and next session that uh, wrongly done surgeries really take years of the patient's life, take years of the family, take have a brunt on his work, on his career, and the poor fellow has only one fault that he had has an accident. You can't have such a uh, bad result just because you've been operated wrong. Okay, so you have to reach. So today, understanding trauma is to reach the right person. त्या क्षणाला खटकन कोणी सर्जरी सांगतंय, take opinions, take a second, third opinion. There are people like
Right.
us around on the net. Search. Like tomorrow we are doing a revision case from some other center. He searched, he waited because first surgery was totally botched up. What happens is it becomes like paneer. The first thing you want to make a tea and somebody त्यात लिंबू पिळतं आणि त्याचं पनीर होतं मला मग पनीर बुर्जी बनवायला. He never remains the same person. So the
Right.
surgeon has to
Get
have
that.
the respect of the soft tissues. The surgeon has to be trained in an excellent center like AIMS, KEM, PGI Chandigarh, where we have handled trauma like mad under the best bosses. We have been extensively trained for 8 years. Then centers in the UK, in Nine Wells and Birmingham and Edinburgh, where we trained in the sports unit. Then Princeton Hospital in the US, where we are seeing this. But the elbow injury I could have missed if I was just a regular doctor, and I
Sure.
wouldn't have known how to operate this, and I'd botch up something. So don't let the doctors experiment on you. Just because he's a big name or he has a big, beautiful center, you should know that whether he's able to do it or not. All right.
Sure.
Now, couple of
Mm-hmm.
couple of other stuff is again these kind of trauma you get. See the multiple fractures again. Here we have passed a percutaneous nail of these six fractures here. The person has only two incisions. You can see this incision here and here. And within 72 hours, the patient goes home. Now, initially they used to plate this, open the हे पूर्ण मांडीचा एक्सरे ते पूर्ण मांडी उघडून तिथे प्लेट लावायचे. These are new techniques that have come, which you always attempt. See, the whole focus, Rajashree, if understanding trauma is you have to save the soft tissue, the thick muscles, nerves, arteries, which the surgeon has to save. Because why are we operating? We are operating so that the patient walks for rest of his life without any issues. And you have to use the right implant of the right quality. Bad quality implants, which we are going to talk in the next session, next time, next week, is one more thing that we are facing because he has done it in a local area.
Yeah.
We should not compromise on that stuff where the doctor. We have refused, Rajashree, cases where patients crib about not having the right implant inside. I refused to operate in this kind of patients where I am answerable to them for the rest of their life.
Yeah.
Now, this kind of stuff, again coming to the COVID era, somebody had an injury 3 months back and totally left plastered because it was a high time of COVID and that particular government center or something was COVID and just left. Young girl. I get a call after say a month that they are searching. They searched on Google and I get from a very very close friend of mine. This patient is poor and I said fine. We can. There is no issue that money will not come in way, but this girl has to walk. And this is what we did percutaneously. The patient was lying on the bed for 3 months because there is some virus outside. There's a
Mm-hmm.
surgeon's not ready to operate. We have been operating from day one. Luckily, by the grace of nature and God, we never stopped in this COVID era. We have learned how to cope up with this COVID. All our centers are internationally now ready. There some centers like say JSH, the Jehangir Specialty Hospital, I go in Kothur is totally COVID free. In Sahyadri, every 3 hourly the hospital has been cleaned. They have made it separate. So we know the doctors now. People should understand that डॉक्टरांना आता कळलं या कोविडला कसं हॉस्पिटलला जायला गेलं म्हणजे कोविड होतंय. आता काही सेंटर्सला जिथे मच्युअर आणि चांगले डॉक्टर्स आहेत जिथे आम्ही अटॅच आहोत तिथे तुम्हाला कोविड होऊ देणार नाही बिकॉज एरिया सेपरेट आहे. असा अर्थ नाही की असं एवढं मोठं फ्रॅक्चर तुम्ही प्लास्टर लावून झोपताय आणि सी व्हॉट हॅपन्स इज राजश्री 3 आठवडे फर्स्ट 3 वीक्स ऑफ द फ्रॅक्चर जर आपण अटेंड नीट नाही केलं it
Yeah.
starts healing in a wrong way, which we'll have a session next time to deal with complex fractures which are wrongly placed or wrongly done. So in those gold, even there is an operative period, people should understand. Again, understanding trauma is first 3 weeks. ideally first 72 hours. And then look at the girl, this is permission is been taken with her, and look at she was on bed for 3 months. Can
Yeah.
you even see the scar? We have bone grafted, we have nailed. This was immediately 2 weeks after the surgery, and now look at her lifestyle. The person who is sleeping home, even toilet, bathroom on the bed, if she gets this life, what more
Wow.
you need
Wow.
uh, from these modern surgeries?
Nice.
So
Very
mainly
encouraging.
these are a couple of things that I wanted to show today. So we'll be showing a lot of stuff. And as you said, robotics is coming down in trauma. Why robotics? To see each individual as an individual. प्रत्येक माणसाचं बोन हे वेगळं आहे. प्रत्येक माणसाचे अँगल्स वेगळे आहेत. तर माझा मेन असिस्टंट जर एक आर्टिफिशियल इंटेलिजन्स असेल, अँड आय नो टू यूज इट, नॉट टू शो इट, टू यूज इट, I can really do this kind of job where people are really, really benefited without the first surgery gone wrong. And bad luckily, if you have a first surgery gone wrong, you can always reach us. You can always talk to us. Like people are reaching out, take help of Google, reach out to us, wait, don't haste for surgery. You can haste for the first aid, definitely. You can stabilize the patient, take mass mentality as they let it relax. 15 people tell you 15 things, but all those 15 people, please understand, reach the right doctor, not the right center only, not the right doctor only. Many times the surgeon is good, even in the periphery, there are good surgeons, but they don't have facilities. That's one sad thing, they have chosen to be there in three-tier cities, and I've seen they don't have CT scan. What happens if the CT scan is in the other center? Patient la uchlun, they have to go to the other center, then they have to do an MRI, then they go to the third center. In that, the patient can get a lot of stuff. So you should have a team. So trauma we don't do in centers like Spectra or somewhere where we don't have these facilities. We can do joints and all, but Jehangir, Sahyadri, it's absolutely trained for, uh, and it's one roof. That's where we can handle trauma. So patients should take a first aid understanding today. First aid wherever you want, nearest place. But when it comes to surgery, when it comes to taking a decision of the right implant, the right surgeon, the right technology, the first decision has to be really, really good, Rajesh. The first decision.
Yep.
Because revisions, we do it, but we are really messed up because again, we have to make paneer out of milk. We cannot make a brilliant coffee out of it.
Totally. And you know how in deep did and in simple manner you explained really to us how much the golden hour is important, and at that golden hour selecting the right hospital facilities, the right surgeon is extremely important, and how important it is that why all this is important, because the surgery in first place has to be successful, and revisions are not really the perfect option at all. It is difficult to make it perfect as it could have been done in the first place. All these points really very, very well understood, and you've also going to talk to us about the advanced techniques, and especially the newer techniques like robotics, which really, really make it very much precise and easier to get perfect outcomes in cases of trauma. So we will be looking forward to knowing more about that from you, and seeing your examples, especially the young girl was so encouraging, and how much disheartening it could have been for her and her family, and with so many years ahead of her life, how it could have been. And also it was so nice to know that orthopedics has come such a long way today, where earlier, where if people would get multiple fractures or in cases of trauma, they would be bedridden forever. And now it isn't like that. And it is so much easier to even get recovered sooner, walk out of the hospital sooner, and even after your back, recover in so much fewer days than before. Knowing all that, but one last point, which you're such a big advocate of, and not just a big advocate, but you've been practicing, is really your team. How much important is the team and a team approach, and then having the multiple doctor access. How important is it, especially in cases of trauma?
Rajashree, it is the important factor. I'll quote it, like the British. It's the important factor. You right from your trained nurse to trained fellow to a trained junior doctor to a neurologist, neurosurgeon, the ICU guy, because these are the people who see them before us. We have an excellent ICU team. Then we have an excellent, both the centers have excellent anesthesia team. Excellent, because they are the people who really have given, this that I show that 92, 82-year-old people with cardiac problems, with trauma is where we have to really have a very nice anesthesia team. I'm very, very proud of them. I keep on quoting them in all my lectures. Second thing, the center has to have access of operating in the night. The center has to have the CT scan, the MRI. Again, that is a team. The center is alive. See, I always believe in the Hawaiian philosophy of Ho'oponopono. Everything is alive. The center is alive. Even the floors are alive. That center has to have the vibes, the technology gives it, and the confidence that comes with the excellent technology. Now, the C-arm image intensifier, video X-ray, what I was talking, there are C-arms which are available at say 5 rupees. There are C-arms available at 40 rupees. We have the 40 rupee C-arm. The technology, the preciseness, why we can do percutaneous good things is we have those technologies at our space. Centers like Sahyadri and Jehangir have endoscopes worth 40 lakhs, where it is available for 1 lakh also. Those technologies really are in our hands. So I'm getting a Maserati and a Ferrari at my hand, and I'm a good driver. I cannot ride a Nano even if I'm an excellent Schumacher. I need that, and team approach is the key for trauma. And especially when we are using these technologies like video X-rays, robotics, we need those technicians who are with us. They're excellently trained. They are the people with our eyes, because we are doing percutaneously. We are operating. They are moving those machines around the patient. They are moving those CT scan around the patient. It's a live video, and we everything we do under computer. Not a single surgery we do without using any computer. Even fractures, even anything except a soft tissue, there's a small tumor or something. Even while we are doing hip aspirations and everything, we take use of this video X-rays. We don't want any trauma, any overconfident, overzealous thing. What is wrong in using technology, Rajesh? So we are using this C-arms, CT scans, MRIs, even for the smallest things, and the results are you are seeing.
Totally. So that really was a very
Of
deep.
course, post-operative,
Yeah.
we always talk about. So yesterday, we did one. See, we are operating all these kind of people from different strata. I always tell the viewers, if you are in a good nutritional back support, your recovery becomes 60 to 80 times better. And again, the team also has good nutritional support, logistical supports. The patients, again, Rajashree, we have patients who cannot pay, patients who are poor. We have centers where we can do in cheaper rates. There are loan facilities available. Treatment should go on. So I don't look into those logistical. We have our clinical directors, we have logistical managing people, where we don't trouble the patient only because of money or lack of technology. They get every access at a very, very affordable rate.
Excellent. I mean, these were really inputs, understanding really how to be, for any layman, how and what to be done when you are facing a situation of trauma. Because this isn't something which we normally discuss, because none of us, are envisioning any sort of accidents, and especially in these times, you're caught unaware, and patients really don't know what to be done when they're hit by an accident. And those are the times where we could be anywhere, any point in time. And such ideal inputs that, from an education standpoint, Dr. Albert, you really shared them with us, and you took those many pains to, making it simple and showing us those videos actually build the confidence in us to, and that we are acquiring the right understanding and knowledge of these kind of situations. Having said that, we are really, like I said, we are really looking forward to understanding treatments, different types of conditions that we face in trauma, and what are the different kinds of treatment approaches. I, of course, as a nutrition expert, and also assisting your team in giving nutrition advice to your patients, keep reiterating that an integrative approach is extremely needed, in first, of course, getting, first of all, getting admitted in the right place, right time, and getting a right, assistance from the team from the beginning up till, really getting treated, getting the right surgery done, the right implants getting put in, and of course, for the recovery purposes, utilizing the right nutrition, and utilizing the right nutrition from the beginning, that you're getting the treatment up till you've completely recovered, and even post that, because in cases of fractures and recoveries, a right set of nutrition is needed. And of course, we will be talking about that in the coming sessions, as we talk about specific issues that can occur in cases of trauma. So we are really looking forward. This has become a treat. I mean, we were expecting that, we're going to be talking more on joints, and more on bone and muscle health, but including trauma in it is really going to be more understanding of things. Dr. Albert, would you want to share any more inputs that we missed covering, or should we now really await your next session, which will be more specific on trauma conditions and how they would be treated and what type of surgeries we should expect, from a standpoint that we can get better outcome, easier recoveries, and of course robotics.
Yes, see, robotics is one big topic, and we are working heavily on robotics on this field of trauma. We already have robotics in our joint replacements, and we had sessions of that. We are using a lot of endoscopy work for the soft tissues fractures like the ligaments. We are including new technologies like all inside repair of the ACL, uh, internal bracing that we are doing for young people, and in robotics, where we are now extending three dimensions in the trauma that we are planning to get in the Google Lens, where the surgeon will have a robot with the planning with a three-dimensional template for fixing the fracture before the surgery. So we'll have a session how robotic trauma is going to shape up. It is under uh, plan right now. I'm one of the designer surgeons for it. And basically, what goes wrong is you open and then you find some, especially in trauma, you find some surprise. And if there is a pre-operative planning on a 3D robot, and you can get a 3D printing of the plate or the template, you can really go there, finish the surgery in benefit of the patients with less scars, less incisions. Rajesh, I would, especially for the trauma, I would like to share those who need, if you can give a minute, I would like to share this number. This is a 24-hour reach number. If anybody is watching it, they can reach us out on this number. I never I this is one thing which I've been. This is 24/7. It's there. You can WhatsApp the reports. You can do everything on this number. It is pan India number. We have you need to have the right access, Rajashree. So using this platform to show this number, and this is one number which we have there on the online. It is on the WhatsApp. It is on Facebook. Everywhere where you can really access if you have a trauma, if you want to take a second opinion, and that's what we can talk about stuff. And in coming times, Rajashree, we are going to you help us to reach out the people
Right.
for complex traumas, the trauma where you have been misoperated, misled. There are times when you are got stiff because of trauma, you have soft tissue issues, you need a revision surgeries, and keep on watching us. And thank you, Rajashree, for giving us this platform to talk. It is very, very I feel very proud and I'm being feeling privileged that you have reached so many international global platforms like Amazon.
Right.
And I've been growing strength to strength with you, and I'm really, really proud of you, what you are achieving. Because this one field, even I couldn't know that you are so good at. We are so doing what we can, but you are
Thank you.
what you really. I'm really proud of you, and I'm really proud of my team. I'm really proud of my patients. I thank them. I'm very grateful to all my patients whom I operated from my day one of surgery, and I'm going to operate later on my life. And I really love what I'm doing. All the doctors should love what they do. They should enjoy it, and the rest falls in place. And I'll be always open to any technology that comes that is going to make me a better surgeon.
Yeah, and
No matter what people say,
yeah.
technology is the passion for me.
And not just technology, but ultimately, what your approach is, we realize that that the patients get the best, and they are safe in these situations. They get the best outcomes possible, correct surgeries, perfect surgeries using the newer technologies, and also quicker, faster, and I would say a right recovery is what we have seen you focusing on. And that's why it's always a pleasure bringing you on this platform, sharing all the authentic knowledge. And we are always assured that, we will get all the nitty gritties and latest information with solid evidence along with it. And that's what this channel is about, and that's what it is about, this series which we are running with you. And it's such a pleasure that we will be continuing extensively doing that over the years, so that we can address problems with the bone, muscle, and the joints rigorously. It was a pleasure always, and thank you very much for coming on our show. Yeah, we just didn't realize when we already have gone over an hour, and in fact,
It
we
always
have
happens.
got. Uh-huh.
It always happens that way. And
Yes.
Rajeshri, next sessions, couple of 1 or 2 sessions, we are going to talk about
Yes.
revision trauma, where
Mm-hmm.
we have treated people with bad fractures, badly treated. We have done revisions
Yeah.
in terms of joint replacements or refixation of the fractures with use of latest technologies and the new implants that have come in the market. So, complex traumas is a series of couple of lectures. All of you, please watch them so that you can, if you are in the first time, no matter if you're on second time,
Mm-hmm.
don't make it the third time. So at least
Right.
the second time you should reach us.
So also there are comments from, of course, Disha and Dr. Disha, and there is Gargi Shirke. Both of them, in fact, are reiterating that this is a great initiative, and that it is nice to see us together discussing these issues in depth and authentically. And I think, yeah, totally, that's the idea and that's the approach, and we will continue doing this along. I would also like to thank my backend team as well, which is led by Mahesh Sarade, to actually bring forth all this
I
relentlessly.
am grateful to him. I mean, it,
Well,
it is.
the thing is, from last week on, we have now actually, with their efforts, started bringing these programs not only on Facebook Live, YouTube Live, but also on Amazon Twitch. We are on two more platforms, that is Picato TV and Periscope, along with, of course, Instagram. So, we are live on
See, I'm
so many
already
different
seeing
channels.
it's more than 4,000 people are already watching it.
Yes, yes, absolutely, and
But
that's the incredible reach. We want to keep adding on and adding more channels, which will be more relevant to take all this knowledge to them. So thank you, everyone. Thank you, viewers, for always coming and encouraging us and gathering all the education that we are sharing out here. And we will be back with Dr. Ashish Arbat next Friday, as it is with our bone, muscle, and joint series. And I would, in the end, want to play a uh, quick editorial of RSG Energia, who always support this initiative, several programs, and with all the sponsorship and coordination that they do for us. Thank you very much. A quick video, and we'll see you soon again.